Good afternoon, and welcome to Redefining Revenue Cycle, exploring opportunities for technology leaders to drive change. A health system CIO production sponsored by FinThrive. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the founder and editor-in-chief of Health Systems CIO, and I'll be your moderator. We're looking forward to your participation. You can send in your questions or comments anytime in the Q&A box, and we'll take them later in the program. Just so you see how we're going to spend our time today, first we're going to go about 35 to 40 minutes with our main panel discussion featuring Audrius Polakaitis, CIO and Assistant VP of HIT with UI Health, Dustin Cragen, VP for Revenue Cycle Management with Class, and Nayan Patel, SVP for Transformation and Technology with FinThrive. And then we will have our Q&A. So let's jump right in and have some fun. Audrius, my old and very good friend, how are you? Let's
Doing
let's
great,
start with
Anthony.
an overview of your organization and your role.
Yeah, so I serve in the role of Chief Information Officer at the University of Illinois Hospital and Health Sciences System. So try saying that 6 times really fast, and therefore you'll understand why we go to the market with the name UI Health. Of course, that has its own confusion if you're in the Midwest with IU Health and the Indianas and Iowas, but this is the University of Illinois Health System. We are a university academic health system. We describe ourselves as a patient care delivery organization together with 7 health science colleges: medicine, dentistry, nursing, pharmacy, public health, applied health sciences, social work. So it's a diverse portfolio that really pursues 3 missions: research, teaching, and patient care. Now, most of my activities are around that patient care environment, call it the 24/7, 365 part. And of course, there are tie into the research components of our organization as well as the education, because we have a lot of trainees that are also participating in care processes. I've been in the organization for approaching 20 years, about 12 years in this CIO role.
Excellent, thank you, Audrius. Dustin.
Yeah, thank you, Anthony. Dustin Cragen, pleasure to be here. I work for Class Research. I believe there's some familiarity with Class in the marketplace, but for those who might not be, we're an independent third-party insights company, and we're very much mission-driven. We only operate in the healthcare sector and been around for about 30 years. Actually, we'll be 30 years next year. But our main drive is to create a level of transparency that is just really difficult to get in healthcare IT. And so we get that essentially, well, 99% of our data comes directly from the mouth of the providers who are using these solutions, both the technology and the services. And then we take and we aggregate that information, we share that back with the providers making decisions. And then, of course, we work directly with vendors, our vendor partners, and provide that feedback to help them improve. So it's this idea around improving healthcare. And I actually, within the walls of Class, I oversee, myself and my team, oversee all of the research that we do in RevCycle, both the technology and the services side. And before I came to Class about 5 years ago, I actually ran RevCycle here in Utah for a healthcare provider. And so I tend to still keep the lens of the provider and RevCycle, in my mindset. So anyways, pleasure to be here.
Well, that's perfect. Another one who has the lens of the provider, Nayan Patel. So, new role for you over at FinThrive. Tell us about that and just give people little highlights of all your experience on the provider side.
Yes, sir. My name is Nayan Patel. I am a former hospital CIO, worked for larger healthcare systems like Baylor Scott White, Baptist Health in Jacksonville, and some smaller ones as well. And so, yeah, for 20 years, I was in the provider space. So I've recently moved to FinThrive as their Senior VP of Transformation and Technology. My hat still is very much provider centric. I mean, at FinThrive, we are a leading healthcare tech company focused on transforming revenue cycle, right? So we have a great end-to-end platform that is, for providers, payers, and patients to what our mission is to make healthcare frictionless. Myself, I'm still focused, hey, it's that provider piece. How are we going to help the hospitals, continue to, you know, improve their operational expense spend and get that revenue where it needs to be. So, yeah, role is involved in a number of things, but it's really looking at a full comprehensive end-to-end platform from the front, middle to the back end, where we actually will help organizations and hospitals, collect that revenue that needs to be collected. We are currently in about 60% of the hospitals in the US, and already in working with many of you are probably on this call.
All right, excellent, very good. So let's jump right in. Audrey, we're going to start with you. How has the CIO role evolved when it comes to influencing revenue cycle outcomes? What are the expectations to lead and support initiatives?
Yeah, so let me start reflecting back on what things looked like 10 years ago. And I'd say 10 years ago in our organization, the way we would sort of think about the revenue cycle was it was a separate thing, people sequestered in a separate building, the clinical activities would happen, things would get thrown over the fence, and then we expect them, the revenue cycle folks, to collect on all this stuff. And over time, you come to realize what a naive perspective about this, that all the things that need to happen in the revenue cycle some of them start even before the clinic encounter, some of them are based on what happens in the clinic encounter. So this idea that at one point had gained popularity, something we espouse and believe in, is this idea of a clinically driven revenue cycle. That really, the two are integrated and they intimately tie into each other. Another moment I'll describe, our former CEO, who now has since retired, he in a previous life was both a CIO and also a CFO in a couple different organizations. So he came with a lot of different perspectives. And one of the things he was my boss, so of course I'm going to listen to what he has to say, right? And he drilled this idea into my head that you can never spend enough on the revenue cycle. The revenue cycle is one of these areas that we are typically under investing in, because a lot of the attention inevitably goes on the clinical operations on that side. But his point being that you will always get a return on any kind of investments you make in the revenue cycle. And that oriented me very much in that direction, to say we have to be involved. So we are blessed that two of our revenue cycle leaders, one that heads up all the hospital billing operations, the other that heads up the professional billing organization, all those activities. We have a very good working relationship. These two folks are part of our EHR governance committee, because again, we believe that that revenue cycle is intimately tied to what's happening in the medical record and the clinical processes. We have every 2 weeks on a Friday morning, there is a meeting with the revenue cycle leadership team. I have some of my directors, the person responsible for the entire application portfolio, plus his manager that is over that area. We have a regular meeting every 2 week, a cadence with these folks. And we just are very cordial and actually get along with each other. So it's a matter about investing yourself personally into this, integrating the revenue cycle operations into even the EHR governance, as I mentioned, and make sure that we have appropriate support. And maybe I'll end with this thought that a lot of this came to a head when we made a decision to migrate all of our platforms to Epic, going live in 2020. And, afterwards, there's this question of, what did you get for it? And, the greatest compliment that I think we received on this, first of all, on the success of the Epic implementation, as well as our attention to the revenue cycle, was when the CFO 2 years later credited our improvement in operating margin within our organization to that implementation. And yes, of course, it has something to do with the Epic application. I think Epic folks would love to see, say it's all has to do with that. But of course, like all good implementations, there's always that element of technology, of course, but then there's the processes and the people side. And we've spent a lot of attention on the people and processes, working those things out, honing those things, so we got a really good outcome. Final thought. Sorry, I already said it was a final thought.
No, go ahead. It's great
Yeah.
stuff.
Yeah. Sorry, can I get one more thought? Sorry.
Yeah, please.
Yeah.
Please.
So this idea of when we talk about failed implementations of EHRs, usually we don't refer to the failed clinical side of it. There are examples of that, but usually it's a failure on the revenue cycle side. And again, another thought to say this always has to have attention. because this is what is making the rest of the organization go from a financial perspective, right? That is how we collect money, keep the mission going for the institutions.
That's excellent. And I have lots of follow-ups, and I'll get to them in a minute, but I want to get comments from the other folks here. So let's go to Nayan first. What are your thoughts here?
Yeah, I think, one thing that you just mentioned is it's about the people and the processes, right? From the revenue side, the tech piece is one element of it, but it's really the failure that can occur on the process side. Again, clinical is one piece, but getting that collection process to what it needs to be. And we know how complicated it is right now. And we know that, revenue cycle is all about from that front end, getting it defined, what type of patient we are receiving, how we're going to be able not just treat them, but then how do we move them through the system so that we can give them the appropriate level of service up as tied to the financial piece, right? Because you have to have the financial piece. It goes back to an old adage that you may have heard of: no mission, no margin, no mission, right?
Yeah.
We have to be able to make money here, right? And so the processes have changed so much over the last 20, 30 years. And we need to keep implementing and improving things around that. There's a lot of automation that we can put in place and all those different things, but it still goes back to that process. We need to evaluate and make sure that we're, tying what are those true revenue cycle processes that need to be evaluated and can be improved upon. And it's less about the tech sometimes as much as it is about the processes.
So Nayan, let me follow up with you on that. Because we want to address the IT leaders and the CIO types. So what do you think their role is in a process improvement in revenue cycle? Isn't that really revenue cycle's role to figure out and get their processes straightened out? I mean, if you come in as a CIO and you're like, hey, you might want to rethink your processes, there has to be a technology angle to it if you're initiating that discussion, right?
Yeah, well, and I think really where it comes down to is for those of you who have sat in that seat, it's all about how engaged you are with, the revenue cycle team or the C-suite in general, right? And once you start asking questions, you're trying to figure out where tech fits into the processes. The dependency is there for sure, right? Like, I mean, technology and all different types of applications are involved in the revenue cycle process. And there's multiple, and then there's the interfaces, I just mentioned the EMRs itself, right? You start there, right? I mean, that feeds the rest of the patient accounting systems. And if you get yourself involved up front early and then saying, what are the end outcomes that you're trying to improve on? So you kind of have to go back to the front, look at some of these processes and find out where technology comes into play, and then look for opportunities for where some improvements can be put in place, whether it's automation or just reevaluating of some customers, right? Vendors in the processes that are in place. When I said earlier that we have an end-to-end platform, I think that's kind of what we look at is, and when I was in the CIO seat, I've been all talking about the application rationalization. And we've done that for the EMR. We've done it for different things. Revenue cycle has the same kind of thing. All these point solutions are everywhere, but what can we do to make the life easier for the hospitals? And that's where if there is a way to do a platform, then it's going to help the hospitals in the end, not just from a cost savings of applications, but just for the complexity around dealing with so many things.
Very good, Dustin. What are your thoughts on what you're hearing?
Yeah, I mean, I think I totally agree with what's been shared already by my fellow panelists. I really go back to this idea, though, ultimately, as an organization, we're looking at outcomes, right? And in this case, financial outcomes. There's clinical outcomes as well, of course, but the financial outcomes. And so, and then a lot of that is driven by really clean and good data to make decisions. And so as I think about the relationship between, like, for instance, a VP of Rev Cycle and a CIO, they both have their strengths. Obviously, the Rev Cycle leader knows what the processes, what are broken, where are the bottlenecks, what ideally needs to be addressed, right? But what gets lost often is because they don't have a technology background, they don't know what technology can actually solve that problem. What's the quickest way to do that? You might think it's one technology, but when you confer with it, ideally your strategic partner in the CIO, and have them go, yeah, I can see the problem that you're dealing with here, but actually, and I can see why you think that, but like, what about this technology? Or what if we did this? Right. And you're solving those problems together to get to the shared outcomes, that kind of that shared alignment. To me, that's where that's incredibly powerful. And the same thing with the CIO, right? I mean, the CIO is not going to be able to just walk into a rev cycle department and go, okay, we're going to do this and we're going to do that, right? They need to understand, and they need to be depth and have the revenue cycle understanding to be able to identify what's happening. I mean, prior authorizations and price transparencies, and dealing with changing payer regulations and contract management, and all of the CPT codes, and like all of these things. And you have to be versed enough that you understand how technology can solve that problem. And so in that way, I see a great complementary relationship between the two. And I don't see ideal outcomes when those are separated and that relationship's not there.
Yeah, and one thing Dustin just mentioned was the outcomes itself, right? So in the end, it's how do you bring hospitals to get that revenue where it needs to be? And then you backtrack it to those data elements. A lot of it does come back to that source data from the beginning and where you're at in the end, because claims devalue with time, right? I mean, that's the reality of it.
Yeah.
If you don't process the claims quicker, the valuation of those, the opportunity to get that revenue devalues with time. And if you go beyond 6 months, you're just leaving money on the table.
Yeah, so Audrey, obviously you realized from some of your mentors and people you worked for that this was extremely important. This was worthy of a significant amount of your attention early on. And so you probably tried to build that relationship with the head of revenue cycle and said, hey, I need to spend some time here. I need to make sure that I'm supporting and driving positive technology into this area of the business as much as I can, and there's a willingness, there's got to be a willingness on the other end to receive, right? For you to partner, right? Because you can want to partner, but hopefully that's reciprocated. Do you think that generally is reciprocated, or is it possible some IT leaders kind of maybe are not feeling the engagement as much as they'd like to on that side? Like, hey, we got this. It's revenue cycle. I'll let you know when I need your help. Or are they begging for it? Are they like, hey, I need all this stuff and all these tools to do my job properly? And as you mentioned, the other element of this, it's a multi-legged stool because the users and the clinicians have to be involved because they're the ones doing the documentation. So you've got IT, you've got revenue cycle, and you've got the clinicians putting in the information. Everyone needs to talk and be on the same page. So what are your thoughts there?
Yeah. I think every CIO's nightmare is being relegated to being an order taker or order fulfiller. Right. And we view ourselves, whether it's correct or not, as being a key strategic partner in an organization's success. And yeah, one of the basic demands, if you position yourself that way, is to have, Nyan put this very nicely, right? You have to regularly engage with those leaders and find a way to develop a relationship, find a common language. I am very fortunate. The two leaders that I mentioned, they were there, right, when we started working on this. One of our revenue cycle leaders, when we were on our old platforms, which was a jumbled mess of disconnected point solutions, right, he was always a guy that was a little bit of a thorn in our side because he'd always have yet another creative technology solution that he wanted to apply, right? So we were trying to sort of slow him down and corral him, right? And if he's listening in, I apologize for describing him this way, but I mean, what that evolved to once we were on what we consider to be a solid platform upon which we could build processes and develop people, then it became a huge asset because he natively was oriented towards bridging that gap, right? And what we're talking about is revenue cycle leaders investing themselves in technology and technology strategy, not necessarily becoming the experts, but investing themselves in there, and technology leaders having to learn the language and the operations of revenue cycle. That is the only way it happens. And now we add to that, we have our CMIOs, because you mentioned the clinical community, right? We have really engaged the clinical community in these discussions as well, right? Because as everybody has noted, the revenue cycle starts within the clinical encounter, before the clinical encounter. I want to reemphasize the point I made, is that in our EHR governance committee, which we happen to call the EHR alignment committee, the word alignment was chosen very precisely, right? You know, governance could be a boring word. We use this alignment committee idea because we want to make sure everybody in a multidisciplinary way is aligned around the direction of the EHR and the things that we are doing in the EHR for optimal outcomes, as already been noted. And it's so key that those two revenue cycle leaders that I'm mentioning, they're there every month at the EHR alignment committee meeting. So they get to hear the clinical conversation. And of course, there's an opportunity for them to bring forth concerns that they have to the clinicians that are in that alignment committee meeting, to make sure we're all aligned, right? And we want to have optimal, of course, clinical outcomes, patient outcomes. We want to have, as much as possible, optimal revenue cycle outcomes, because as already was pointed out, you know, we need to make a margin, right? This is the only way we sustain ourselves and the mission that we pursue.
Perfect. Dustin, any more thoughts there?
Yeah, just that, yeah, historically, we've always approached things generally in silos. And even though the process, or you look at the operations of a health system, you can describe it linearly. I mean, it's not obviously worked that way, right? And in the last decade, we've spent a lot of time on the front end of rev cycle, like patient clearance and all of that. But still, you generally have that patient coming in, and then you have the clinical intervention, and then you have rev cycle. And so even like optically, like when you look at it on paper, it's like rev cycles at the tail end of things, and they're the downstream of everything, and they just sort of absorb everything that comes their way and all of the problems, right? And their job is to use duct tape and popsicle sticks to like fix things, right? Well, we've come to our senses to where so much of the results are driven from upstream actions, right? The clinical interventions and different things. And we always kind of, in rev cycle, we say garbage in, garbage out, right? Well, if that garbage happens right at the beginning, or right, on the front end, there's no chance of collecting that money. So I think as an industry, we've done a great job of recognizing that dynamic and being able, as Audrey has said, is bring people to the table and talk about it. The other thing I would say is, and this is really fascinating for me at class, I'll get on a phone call with a provider, and I can tell pretty quickly their general culture of the organization. I get on the very next call with a totally different health system, and it's a totally different culture. And I feel like we've done a pretty good job. There's still room to improve, but the culture starts with the CEO, and of course you'd lump the CIO in there as well, right? The executive, the C's up there, right? Is the culture one of interdependence, and we're sharing data, and we're sharing ideas, and we're helping each other in a shared outcome? Or is that culture more like, hey, that's Dustin's job over there, don't step on his toes, don't get involved, just let him do his thing, he makes his own decisions, kind of a thing, right? And so I think we've done a great job with culture in healthcare, that recognizing the interdependency, that cross-functional team involvement in a shared outcome.
Yeah, Nayan, it's really interesting, right? I mean, so much of the success, and especially in a health system, depends on these human to human relationships, and right, because we always use the word partner and support, but it takes willingness on both sides to get that right. And I was thinking, as Audrey has talked about his governance committee, that helps a lot, because if you get that straightened out at the beginning, if you get the right committee in place with the right people on it, and you sort of have the regular meetings set and they're going to happen automatically, that's a little bit of a set it and forget it, and it kind of takes care of itself a little bit, because you'll have the right people coming together at consistent frequency. But what are your thoughts on that type of element, just the criticality of these relationships?
I mean, having the right seat at the table is the key, though. I mean, Dustin mentioned it. If you understand how leadership operates, they have to be operating together, right, with all the same goals in mind. When you look at a lot of IT projects in hospitals, they're not IT projects. They're business projects that are technology enabled, right? And if you just have to have that mindset different. Now, in the case of revenue cycle, that means the IT leaders or the tech leaders have to understand more of the processes. What is this project for? You're going to go through XYZ application in the revenue cycle space, and it may have an upgrade or maybe a new implementation, but you really want to see what is the outcome that you're trying to deliver once this is put in place. And we know about every application has to have, change management and training related to it. Well, in order to really understand the impact of that, you kind of need to understand what the processes are and where's the objectives, right? And so it does require more time and effort. But once the tech leaders engage the revenue cycle leaders in this case, that's when they're going to really say, okay, how we're going to help the business, deliver the ultimate goals. Because we know it's every project technically is about making money or reducing cost for the organization. If you're not involved in thinking of it that way, then you're not understanding the key objectives around it. So yeah, I think, when you look at all the different point solutions out there and the different examples that are given, I think you just have to keep taking a deeper dive into that and looking at it as a business project and making sure you understand the processes around it. And that's why you really have to say, what is the outcomes that you're trying to reach here?
Hey, Anthony, I had this
Yes.
thought, sometimes when we talk about revenue cycle in the context of a healthcare organization, it almost feels blasphemous in the sense that, but listen, we're here to help people, right? I mean, people don't show up to us because they got nothing better to do. They come to our organizations because they need help. They're in a very
Yeah.
crucial moment of them or their family members, right? In a critical moment where they need assistance. But that comment about, the thought that mission needs to be sustained by solid financial footing, right? There's capital intense projects we got to have margins to be able to provide that capital spending opportunity to renew equipment and refresh facilities and grow and expand and improve access. So when you look at it from a balanced scorecard perspective, there's always, when I think about alignment, there's always those clinical parameters, right? Within a leadership, what we're evaluated as a leadership team. But one of the ones that I'm accountable for, as well as all leaders, is we track net patient revenue, right? And that's a high level KPI, and there's a lot that goes into that, right? It's about demand and volumes and access, but also integral in that is your net effectiveness of your revenue cycle operations, right? What's your clean claims rate? What do denials look like, right? All of this plays into that high level KPI. This is another way to create alignment, that you have to be invested in order for the organization to achieve that success.
So, Audrey, to follow up on that point, it almost sounds like you giving advice to a younger CIO who might be drawn and pulled to the clinical side, especially with all the AI stuff going on. And one of the biggest things you want to do in your job is make physicians happy, right? And you want to give them the ambient listening and you want to do all this stuff. But I think your point is that you guys and ladies have to remember that this is so important and you can't get your eye taken off this ball no matter what else you're doing. Is that correct?
Yeah, I'm going to use a word that maybe others will be offended by. Revenue cycles rarely referred to as the sexy part of the work that we do, right? The attention naturally goes to the clinical side and the clinical, especially in an academic medical center, right? The clinical innovations, the research that's happening, the new approaches to disease management. This is the part that gets people excited. As you mentioned, AI now sort of contributing to that. But yet there's so much else, right? And you're running a business, you're running an operation. I mean, things like scheduling and making sure people are available and facilities are clean and bills are paid and you're appropriately collecting money due from insurance providers. Yes, it has to be a 360 view of the organization and all of the operations that are needed to sustain an organization.
Yeah, I
Yeah,
think
so go ahead.
Yeah, Audrey, you pointed out something that I think people really do think about patient care all the time. Healthcare is all about taking care of patients, and we have to be patient centric. That has been, I know, I'll say about 15 years ago, that was a big theme, right? But now I think we have to look at it more like, well, without the margin, you can't do the patient care. And it does need to be intertwined together. And healthcare or hospitals, they're just like everything else. It's a business. It's an organization that is in it to be a business, right? You're not going to have a hospital that is just going to lose money. You can't do that, right? Or even break even. There is objectives, there's people who are running it, and it has to be treated like a business that has the outcomes of clinical care as well as profits.
Now, let me ask you, because it sounded like everybody touched on the idea, and this is always, I've always been in tune with this on the clinical side and spoken to CIOs, especially who were not MDs, as most are not, and how they had to understand clinical operations as much as possible in order to effectively support clinical operations. And they had to round, and you have to talk to the physician, you have to see what they're going through. And it sounds like everyone has touched on that same angle with revenue cycle, because you could wind up being a CIO, maybe you could have come up through infrastructure, right? Lots of CIOs come up with infrastructure and network, and you may not know that much about what actually how the revenue is processed, the revenue cycle is done. So it sounds like everyone has touched on the idea that you really need to spend the time, and you have to be humble, right? Because if you're going to learn something, sometimes you have to expose yourself as not knowing maybe as much as you should know or people thought you knew. So you have to get over that and really understand the revenue cycle so you can be an effective partner and assistant. Does that make sense, Nayan?
Yeah, and in my last role, one of the things we were going through was a big RCM upgrade, and I wanted to understand, well, what is this mean? And we did rounding. We already had the rounding that was built in, monthly leadership rounding. Everybody had to go round, and you got a different department each month. So on occasion, I made my staff do the rounding because there are a couple people on our staff that doesn't like to get out of their box, right? And I'm like, no, you need to get out because you need to understand what work you do and how it impacts the business and how it impacts your ability to take care of people who take care of people, right? That's what we do. And yeah, so I actually had sat down with an RCM leader to say, hey, walk me through a high level. Like, I need 30 minutes of your time and just help me understand this world a little bit, right? And what does it take and where, just give me some of the basic terminology. But I had to do that on my own, right? But we have to take the time to go do that. If we're not taking the time to go do, and everybody wants to help. So I think that's where it starts. It's getting involved. And then, when we're in our seats, we're going to be looking like, oh, so why are we having 5 different solutions when we could probably do this in 2? Or did you know that the same data flow is kind of already in these different areas? Maybe we should reevaluate what we're looking at, and that helps us kind of reduce the complexity that just kind of got generated by different methods over the last X years.
I love that.
Yeah.
Hey, Anthony, oh, sorry, go ahead, Dustin, go ahead.
No, I was just going to say, all it takes is one of these incidents where, you book on the P&L, you revenue of $50 million in net patient revenue, right? But then the cash is only $45 million. So there's this $5 million discrepancy in cash and bills aren't being paid. And people are like, wait, what's going on? And then they start peeling back, lifting up the hood to see like there's these bottlenecks and there's these technology downtime and all these things for a CIO to go, oh, I can help here, right? The minute the cash drops, the actual cash collections drop, it changes the focus of the organization pretty quick, right? So,
Anthony,
Yeah.
I really like what you said about a certain humility, right? Because I would say in revenue cycle, I know enough to be very, very dangerous. I am not an expert in that field, right? I didn't come up through that area, but I have to be willing to learn and to listen to the folks that are. And it becomes this sort of symbiotic relationship because our revenue cycle leaders maybe have ideas. We want to maybe put them in certain lanes to think about the big picture systems thinking as Nylon talked about, right? But the operations, I don't have personal experience with that. That's their responsibility. So there are ways we help them, and then candidly, right? There's times when we screw things up, like a build mistake in Epic, which suddenly we're overcharging or double charging for lab results, and they got to go back and submit claims for 10,000 labs that were double booked, right? they could be very upset at us because it's our mistake that caused this extra work. But you hope that support of each other wins the day at the end of the day, right? That is the right way. We have to appreciate each other's knowledge, find that common language for all of us to drive things forward.
It's a very interesting point, and I wonder, you talked about how changeovers of systems, when you see a failure, when you see a big failure and a scary failure, it can be on the revenue cycle side, right? We were changing systems or we did an upgrade or something. Like, it's scary to touch it to me, right? If I was the head of IT, if I was a CIO, I would probably do everything else besides that because it's so scary. It's like lifting this delicate egg that's so fragile, and the consequences of getting it wrong, as you mentioned, Audrey. So, is there is there a fear factor here that keeps people from maybe doing things that you might otherwise jump into a little more because you're so afraid of messing up something with such consequences? Audrius?
Oh, I was hoping you wouldn't direct that question
It's
towards me.
scary.
But no, yeah, yes, but this is where you depend on your colleagues and the relationships you have with the revenue cycle experts. So yeah, again, approach it from a team perspective that
Yeah.
they have certain insights that I don't have, and vice versa. So it is scary. And when I think about, for example, our go live with that new EHR platform that included all the revenue cycle solutions in 2020, there was a heck of a lot of attention paid to the integrity of the revenue cycle processes, right? Because it was that understanding that success on the clinical side, but failure on the revenue cycle
No
side,
good.
no one would call that success,
No.
right? Like they both have to be there, right?
Yeah.
They're equally important. And again, a lot of attention paid on that, a lot of testing, a lot of conversations, big group engagements into everything from, the scheduling registration process, the charge capture, the documentation, right? You do the whole end-to-end workflow, which ends up
Yeah.
in a claim, right? And hopefully payment.
Yeah.
And
Let me go to. Go ahead, Dustin.
Yeah, and I would just add, there's that element of like a total migration to a new host system or whatever, but you also have this entire element where, and I live this, right, which is I had a system that was generally working, but it wasn't fully optimized. And so when you start looking at pieces like, let's say, the clearinghouse, and you start to think to yourself, I think there's probably a better clearinghouse for me, or better pricing, or better edits, whatever, right? You think to yourself, well, I've got 99 problems, but right now my clearinghouse isn't one because it does work and the claims are going out, right? So now I'm deciding, do I cut the cord, right, which is stoppage of cash, and trust that this new vendor is going to get me up and going without disruption, et cetera, in hopes of reducing my costs or having better outcomes, right? And so that cost to yield is a really tricky one when systems are already working. And so I think for that reason, we often sit in rev cycle, and providers tend to just justify that what they have is good enough, when the reality is there's a lot of opportunity to fully optimize, right, and get better results.
That's such a great point. I want to let's talk a little bit about this. And I don't want to mention specific vendors, but Nayan touched on the idea of point solutions, right? Lots of point solutions.
Yeah.
You have lots of integration. It's sort of that thing you get away from when you go to a big enterprise vendor on the EHR side. The same dynamic, right? You're consolidating. You're doing away with a lot of interfaces. Life gets a little easier. You remove some of those problems of duct tape and all that kind of thing. But sometimes point solutions, you use them because they are outstanding in that particular area, and so you can't use more of a suite. So it's that balance, and I have lots of conversations, lots of webinars about this particular dynamic that everyone deals with and tries to manage as best they can. So Nayan, if you want to talk about that concept a little bit, and then I also want to bring in, could be a separate discussion about AI. We talk about it on the clinical side, but certainly I believe it's having a major effect on the revenue cycle side as well. So um, those two ideas, Nayan, and then we'll go to Dustin.
Yeah, so I mean, I think so first of all, AI and automation, it's been around for a little bit, RPA, right? I mean, robotic process automation. AI is taking it to that next level. And there are all these, and when you break down the overall RCM process, there's so many places that it can be applied. But going back to what you really were inquiring about is these point solutions and what can be done about kind of addressing it. Well, technology is a part of all of this. HFMA actually has what they call their RCM TAM, which is a revenue cycle management technology adoption model. It's kind of like MRAM that HIMSS has done, right? And this is their version of it. And if you get a hospital to go do that, and it's either low cost or free, depending on how they qualify you, that's going to give you a roadmap of where the hospitals need to maybe spend some money on, or just look at where they are benchmarked against like-size hospitals. And that is where, there's going to be an opportunity to say, it looks at the whole life cycle, right? From the front end to middle to the back end, and where the pieces that, are going to be involved for opportunities for improvement. Because the data is everywhere in all these different places and it's interconnected. But HFMA took some time to kind of look at that big picture and try to see where technology plays into that. And so I think that would be a starting point for many organizations if they, or even just to see where they are benchmarked. They maybe feel like they don't need to spend as much money, but they can see where they lay out. So it's probably worth the time and investment to go do that. And so, that's where, our organization certainly comes into play. And because we will be able to say, we have, capability for that end-to-end platform, and here's how we can help. You don't have to do all of it either, right? And so ideally you want to be in some kind of, platform play, just like you have everything in the EMR. I will tell you, 20 years ago, not everybody was on the major EMRs. There were still so many pieces of it that were on different pieces. I remember when ED was always separate, okay?
Yeah.
Or,
Yeah.
GI was always separate, or whatever different functions.
Yeah.
Now the main EMRs have them all, but it took them a migration path to get there. It's probably going to be the same thing in the revenue cycle space. So, Dustin, I don't know if you want to, tell us what you think, what you see from, other hospitals dealing with RCM.
Yeah, no, those are great points. I think when we think about we have seen a proliferation in platform adoption, or you could at least say being deeply adopted with a single vendor, right? Most certainly we have. I think there's still some that are many that are still in that point solution, like always getting the best, best of the best. One of the things that's been very interesting, and by the way, I'm not trying to plug class, but I will say, because all of our data is free for CIO, so I'm not trying to sell anybody anything, or for providers and of course CIOs. You can go to our website and pull down a platform report in RevCycle for free if you'd like. It's there. We did it about 18 months ago. But one of the things that's really critical about this is that when you do, proactive service and strategic guidance comes through loud and clear from providers when they're engaging with vendors, right? And so when you're dealing with a platform vendor, you want to make sure that they're going to be there in all areas of the platform, that they're going to be there to guide you, to help you with best practices. If something happens with one piece of the platform or the whole platform, they're going to be there, right? Versus like if you have that as a platform, or excuse me, as a point solution, and you have a bad vendor experience, that's one issue, right? But it doesn't infect the whole thing. And so that was one of those interesting data points that came out in our research around platforms, was how strongly the vendor organizations are really partnering with their customers, and under no circumstances would they let them fail, right? Because when I say all the eggs are in one basket, that's totally fine if you're getting high performance, but you also need that hand to hold. And then I think there was a little bit of maybe a second question in and around AI that we were talking about there. Yeah, I mean, certainly, well, we can get into discussion about what is AI or what is not, but certainly providers are always looking for outcomes. And so when we think about they've grabbed onto AI because they feel like it's going to do these wonderful things. And it certainly is. It shows it's got tremendous promise. We're seeing already great outcomes, right? But at the end of the day, I don't think providers care about whether it's RPA, screen scraping, AI, or a hamster on a wheel, right? They just need to know that they're going to be getting these outcomes. But the areas that we see for sure the most, I think, involvement with AI, if you want to say that, is well, ambient speech is something class gets asked about probably more than anything, right? But then really coding initiatives, anything in that mid-rev cycle is, I mean, because you think about, you have 40 nurses that can audit 30% of your total charts, right? And they're just looking the best they can to find things. Whereas you can take an AI and audit 100% of the charts and prioritize them, right? And literally, I talked to a provider yesterday on a solution that said that it audits their entire chart and increase their revenue optimization, right? $1 million a month, just because it had this technology that could go through, right? So I think we're on the forefront of being able to see some pretty awesome abilities of AI around addressing large volumes of data and the quality of the data that humans just aren't good doing long term.
Dustin, this is totally slightly off topic, but
Yeah.
if one organization is increasing their billables from payers by $1 million a month, and that's going on industry wide, what the heck are the payers doing? Their outlays of cash are going up astoundingly. Are they fighting back with AI that tries to knock this stuff down?
Yeah, that's super interesting. You know, I can't really speak for their defense, right? But because that's right, that's very valid and very fair, right? But as you think about what's really happening within the walls of the providers, right, for that to occur, the premise is that they were not capturing all of the clinical interventions on paper that they should be paid for. So I don't ever feel like somehow it was like this. Sorry, it doesn't come across to me like it's this gift, like, ooh, we found a loophole. To me, it's, hey, we were never operating and capturing all of the clinical interventions correctly and documenting it in a way that we've already contractually agreed that you will pay for. So now, whether the payers look at it that way or they feel like it's overbilling or all that, I don't know. You don't want to get into an AI arms race,
right?
But I think there's low-hanging fruit, which is providers can now have tools to make sure they're fully optimized for the work that they've done.
Yeah. And I totally agree with you. And what you're saying about the providers is 100% dead on accurate. I'm just saying, if I'm running a business, which the payers are for sure, they're not for profit. If I'm running a business and my expenses just went through the roof, that doesn't sound like something, you know, but they seem to have enough profit that they could probably absorb.
Isn't this why we cynically say that from a provider perspective, payers are constantly changing the rules to keep us
That's it. It's the arms race.
balance, right?
It's the game.
And the requirements seem to change regularly, at least from my point of view. And you know, suddenly you were doing well, now you're not doing that well. You got to make your own adjustments, react to your adjustments,
right?
And so we go, right? It is a little bit that arms race, right? That's absolutely what's happening.
There'll always be a little bit of a gap between when they change the rules and when you guys figure out how to get back up to speed.
Yeah,
and then
for sure.
So
and
anyway,
to
listen. Go ahead,
to Dustin's point, they are definitely the payers are gonna definitely look at probably putting their own version of RPA or AI around it, because if they can find reasons to deny a claim quicker, that helps them too, right? Or automatically then, because we're tied to whatever the rules are, like Audrey just said. And if they change the rules slightly, then they can, you know, put in different elements that can, you know, push the claim back or get it denied, you know, quicker. And so there is going to definitely be a bot versus bot scenario, because we're doing everything we can on our side to help the hospitals get the claims processed efficiently, quickly, accurately, right? So that they don't get rejected, right? That's the objective we all want, because we want the hospitals to be more successful. They're the ones who take care of the patients. So
yeah, and we've all, you know, we come across these science fiction type bot versus bot war scenarios, and you know, see whose bot wins. Anyways, good stuff. All right, let's we have a little bit more time. Audrius, do you have I would love to hear this. Do you have a question for one or both of your co-panelists?
Oh my. Yeah,
make it good. Come on, make it real. Something you're curious about.
Okay, all right, here we go.
All right.
So we had gathered a little bit before we went live,
Yes.
and I had noted that I had been snooping on my
Oh
co-panel.
no.
Yeah, and it turns out that Dustin's bachelor's degree is in zoology, right? And of course, we could probably all look back to our history and say that our undergraduate degrees match with what we're doing right now. But
I actually have a major. I majored in anthropology. So Dustin, I hope that makes you feel a little better. Go ahead.
makes me
Go
feel
ahead,
old.
Audrius.
Okay. Anyways, so here's the question for Dustin, just in the spirit of that. What is your favorite zoo animal, Dustin?
Oh, that sounds like something you ask a 5-year-old. But anyway, go ahead.
Well, in the spirit of fun.
All
Yeah.
right, no, I love it. I
Yeah,
love it. Go ahead.
that's
And
awesome.
why? He's
That's
got to say
awesome.
why and why.
And why? Yeah, well, look, I think initially you generally always say the monkeys, right? Just because you're watching this train wreck happen, and there's just like it's like NASCAR. There's all these races within the races, right? So I'm ultimately going to say a monkey, and I'd also say for the entertainment factor. But also, I don't know about you all, but as a kid, didn't we all kind of want to didn't we have a window of time like 6 months where we wanted a pet monkey? We thought it would just be like an amazing pet. I don't know about you. I did, so that's what I'm
Yeah.
going with.
Yeah, and they can use the tail like another arm or leg, so that's pretty
Yeah.
cool. Yeah.
All right. Thanks
Oh, I'll
for
go with that.
entertaining the ridiculous question. All
Yeah.
right.
Do you have a real question, Audrius? Maybe work related?
Is
Maybe?
that a requirement of this forum?
No. Well, yes. It's called Ask a Co-Panelist. Yes. Do
Yeah.
you
So
have?
maybe for Nyan. So what has been the biggest aha moment for you moving from, let's say, that CIO based role into working for an organization that supports CIOs and healthcare delivery organizations?
Yeah, no, I think for me, it's the impact that we can actually have on the hospitals. The fact that, there is so much opportunity to get those claims processed quicker, more efficiently, and get more revenue to the hospitals. I didn't realize how much opportunity there is for hospitals to improve their revenue cycle um, area or their functions. And a lot of it has to do with processes. Some of it has to do with applications. We have a SaaS part and we have a services piece too. But part of it is just some of it it's manual, unfortunately, right? Because that's the world we live in. It takes people to do the coding to get the claims processed. And I think if something that has stood out to me the most is the realization that there's so much opportunity to help the hospitals more than the payers, right? And actually even patients. We have a solution that helps patients identify insurance options that they didn't know they qualified for, right? Like these are little things that I never thought about until I came into this organization. And I think the hospitals don't even know that these things are available, right? And so I think the hospitals can benefit from improving their bottom line, which everybody wants hospitals to be more profitable. But the revenue cycle is such a big key piece of it, right? It's not the technology, it's not ambient listening. I mean, these are certainly things that help, but how does it tie into the bottom line revenue? And that's going to make hospitals be able to do more.
All right. Does that qualify as adult,
That
like,
was
serious
good.
question?
That was. I did enjoy the Dustin. Now we know he's a fan of monkeys, so I did enjoy that. That was great.
All right.
I just wrote down, and I had never, this phrase had never come to my head before, but the cybersecurity folks have achieved the branding of cybersecurity is patient care, right? That's down. That's done. It took them a couple of years, but cybersecurity is patient care. And I don't see why revenue cycle should be any different. Like revenue cycle is patient care. There's no patient care without revenue cycle. There's no patient care without cybersecurity. There's no patient care without the network working and the infrastructure, right? So it's valid. I mean, does that work for you, Dustin? That revenue cycle is patient care?
But for sure, I think about and perhaps you've all had an experience where you get a surprise bill, but being in rev cycle, I remember a $3,000 bill going out to a family, single breadwinner, you know, clearly doesn't have a lot of money. What is that impact going to be to them? So great, they had a good clinical outcome. The broken arm was casted and taken care of, right? Or whatever. but then they get this big bill. That's very financially distressing and emotionally distressing, and things that you might be digging out of some of those things for a long period of time. And so it is a mistake to separate the financial and the clinical outcomes when it comes to the well-being of the patient, right? And conversely, we all know, look, if you have a terrible clinical outcome and you don't get the health care you need, you're frustrated. But if the rev cycle piece is perfect, you're not like, well, at least they billed me correctly. Yeah, right. I mean, it doesn't work that way. You cannot separate that. And so I love the organizations that understand patient well-being is driven by many things, and
Yeah.
rev cycle is part of it.
And Dustin, just to follow up on your point, I would argue that even if they ultimately don't have to pay that $3,000 bill, fighting it and dealing with it and the stress of possibly
Oh,
having to pay it, that will just destroy you. That will
mhm.
destroy you. And so it's not inconsequential. And sometimes dealing with those things is horrific. Getting the right people on the phone, getting the attention you need, all
Well,
that
and
kind of
I'll
thing.
even say, I mean, this is a little bit down a rabbit hole, but I mean, like you think about, we're all in healthcare. So when we get EOBs, we even kind of question, okay, wait, what does that mean? What is this? What is that? Right. So it stresses our financial literacy a little bit, right? But we're in healthcare and we know who to call. But can you imagine having very low financial literacy? Like you don't know what a copay means. You don't know. And there's a large piece of the population that had no idea
Yeah.
what any of this means, right? So not only is it distressing to get that bill, but then to literally not know how to navigate that,
Yeah. And maybe
it's
not even know that you can fight it, and maybe just
right.
No,
start trying
absolutely.
to figure out how to pay it because you assume I got a bill. I have to pay my bill. Anyway, as you said, a bit of a rabbit hole, but it just reemphasized the importance of what we're talking about. We have to wrap up, so I'm just going to get a quick final word from Audrius and then Nayan, and then I'm going to let everyone go. So, Audrius, you want to go first? Any
Yeah,
final
real
thought here?
quick, I think the theme of our discussion, and I really enjoyed this discussion, was pay attention to the revenue cycle. That is an integral part of an organization's success, as important, arguably, as the clinical side. Because without that, you can't have a clinical side. You can't have a
Yep,
sustainable clinical side.
perfect. Nayan, I'll give you the last word.
Yeah, I think not only pay attention, ask about it, learn about it.
Yeah,
Okay, every technology leader, I mean, we're CIOs or former CIOs, whatever. Every part of the IT world, they need to really, maybe ask more questions about what is revenue cycle.
yeah.
Get a broader understanding because every project ultimately somehow will impact the bottom line. And if you understand where that revenue flows in a hospital, it helps you understand how you can better deliver that technology.
I love it. Absolutely perfect, and I think extremely valuable. That's about all we had time for today. Regarding continuing education, you can use the final slide in this deck for your certificate. You'll get an email when the on-demand recording of this event is ready for viewing. If you want to work with us, you can reach out to Nancy Wilcox from our team, or you can go to our website to register for upcoming panels. With that, I want to thank our tremendous panel. This was wonderful. Audrius Polakaitis, Dustin Cragen, and Nayan Patel. I want to thank FinThrive for sponsoring and making the event possible, and you for attending. And with that, everybody have a wonderful day. Thank you. Thank you, guys.
Thank you.
Thank you.
Thanks.
Take
Bye bye.
care. Bye.